I'm Matt Willis, Public Health Officer with the COVID-19 update for July 31st. We've been getting a lot of questions about the state monitoring list, or watch list, and what it means for Marin. I'd like to answer some of these questions. The state watch list was created in late June as a way for the California Department of Public Health and the governor to identify counties with elevated COVID-19 transmission rates and control their pace of reopening. There are 37 counties statewide on the watch list currently, which makes up 93% of the state's population, including all Bay Area counties. It's a way for the state to put on the brakes and issue restrictions on local reopening. Marin was added to the watch list in early July. What's important about the watch list is that it sets limits for what we can reopen and when. Because we'd taken a cautious pace towards reopening in Marin with slow and sequential steps through May and June, the impact in Marin was less severe than in other counties. At first, we had to close indoor restaurants, and then a week later needed to close indoor malls, non-essential offices, and had to move hair salons outdoors. But being on the list also prevents us from opening many of the sectors we had planned to. For Marin, the most important factor or metric that gets us on the watch list is our overall case counts. Here's the most important number to remember regarding the list: 19. That's the maximum number of daily cases on average that we can have county-wide in order to stay off of the watch list. Above 19 cases per day for any prolonged period, and we're on that list. That number is based on the cutoff established by the state of 100 total cases per 100,000 residents over the past 14 days. This is the standard way this is measured across the state, and allows for comparisons between counties and over time. Raw numbers don't work for meaningful comparisons between counties. Los Angeles County, for example, has more than 40 times the population of Marin, so we'd expect a lot more cases in LA. That's why we use rates per 100,000 residents. In Marin, because we have about 260,000 residents, that state cutoff amounts to about 260 cases total over 2 weeks, or about 19 cases a day. Right now, we're averaging about twice that number, which brings us close to 200 cases per 100,000 every 2 weeks. One key sector that's tied to our status on the watch list is schools. Counties on the watch list are not allowed to reopen schools to classroom-based learning unless the local health officer grants an exemption to any given school who seeks a waiver and qualifies through an application process. The state will be offering a template for this application that we will modify with the Marin County Office of Education and circulate to our community next week. Any schools intending to file an application to open, despite our status on the watch list, will need to submit this standard application. The likelihood that a waiver application will be accepted will rely a lot on our local case rates. One piece of good news is that our hospitalization rates have stabilized and declined over the past 2 weeks. As July ends, there are fewer people hospitalized with COVID-19 today in Marin than at any other point this month. There will be ups and downs along the way. So that's one goal we can all share. Let's work together to lower our case rates to less than 19 new cases per day. We'll only get there by doing everything we can to limit transmission across our community. By this point, we all know what that takes: covering your face, maintaining physical distance, and limiting your activities in the community as much as possible. Thank you for doing your part.